Hi, my name is Sasha Blair. I'm a student nurse at Cedar Crest College. My presentation is on the return of bowel sounds indicating an end of postoperative ileus is a time to cease this long-standing nursing tradition by Robert L. Macy. So the problem of the study, Macy wanted to find an appropriate indicator to determine the end of postoperative ileus or POI because for decades nurses used auscultation for return of bowel sounds to indicate the end of POI. He wanted to find more reliable methods to determine, as well as knowing if standard care or the rocking chair method would decrease the time of return of bowel sounds and the passage of first flatulence. The problem is significant to nursing because nurses must be aware of how patients are healing and the overall health status after abdominal surgery. Having reliable treatment methods or indicators will give nurses the correct direction when teaching patients and family members how to care or monitor signs and symptoms of end of POI. So the study question is, should auscultation be a reliable method for the return of bowel sounds as an indicator for end of POI? Macy hoped to disprove this theory to allow for more reliable methods to determine end of postoperative ileus. So the conceptual model or theoretical framework. The conceptual model used was the Iowa model of evidence-based practice created by Titler in 2001. And the study had no theoretical framework discussed. The variables were the rocking chair method and the standard care intervention as independent variables, and the dependent variables were the return of bowel sounds and passage of first flatulence. The research variables were the diet of, not discussed in the article, but can be concluded that they might be the diet of the participants, how long patients are able to ambulate, and any opioids they might be taking causing constipation. So for the interventions, the rocking chair method, patients had to get out of bed to a rocking chair for 10 to 20 minute increments for at least an hour a day until passage of first flatulence. Previous nursing research has been done to prove that this is effective to determine the end of postoperative ileus. For the study, for the standard care postoperative, patients had to get out of bed, sit in a non-rocking chair, and ambulate after the first day postoperative until passage of first flatulence or stool occurred. There is no evidence to correlate that causes the end of POI. So for the study sample, the sample size was 66 participants, 34 participants in the experimental group or rocking chair intervention, 32 participants in the control group or standard intervention. The groups were randomly selected, and no power analysis, acceptance rate, or attrition rate were discussed. So for inclusion and exclusion criteria were patients had to have digestive system cancer and scheduled to undergo abdominal surgery, signed a consent form, English speaker, be cognitively intact, able to ambulate and sit in a non-rocking chair and a rocking chair, and receive patient-controlled IV or epidural pain medication. Exclusion criteria, patients without digestive system cancer. They do not qualify for abdominal surgery or are not scheduled for abdominal surgery. They aren't able to ambulate, sit in a non-rocking chair or a rocking chair. They do not speak English and cannot take any pain medication. So for the ethical component, they obtained approval from the University of Texas Anderson Cancer Center Institutional Review Board before beginning the study, and participants also signed a informed consent form before being randomly assigned to groups. So the data was collected. The primary investigator, after the first day post-operative, assessed each patient at the same time each morning for the return of bowel sounds or passage of first flightus. The primary investigator also auscultated the abdomen for 5 minutes in all 4 quadrants in each patient for the return of bowel sounds and reviewed the patient's medical records to determine any bowel sounds. All data was documented in a study data sheet by the primary investigator. The research team performed this data collection to compare the two groups. So the results indicated that there's no difference between the rocking chair and the standard care group methods, and as you can see, the numbers match. The final results are as stated. The study also found that the rocking chair group did not impact the duration. So when the combined group results, R is 0.231 and P is 0.062, proving Macy's findings. The results concluded that there were no relationships between the return of bowel sounds and the end of POI, making auscultating for bowel sounds an unreliable method. Macy's data also supported Matson et al. In 2005 study that auscultating was not a reliable method to determine the end of POI. So the study limitations included the sample size being too small, so it's difficult for the authors to generalize the sample to the general population, as well as the study having so many requirements, making it difficult to get a larger sample population. And also there weren't any demographics considered in the study, as making it again difficult to generalize the results. And auscultating for 5 minutes in each participant limited the study because only the primary investigator was doing that. The implications to nursing is that he recommends that nurses auscultate with caution because more evidence needs to be found for reliable methods, meaning that the auscultation of bowel sounds for end of POI is not reliable. The researcher also recommends that nurses use symptoms like nausea, vomiting, passage of first flightis, decreased abdominal distension, intolerance to diet to determine end of POI, because having more reliable methods to determine end of POI will allow healthcare professionals to be aware of comfort measures and perform proper assessment techniques with patients. So my conclusion is that further research must be done for other reliable methods to make it comfortable for healthcare professionals and nurses. The researcher also found no correlation between return of bowel sounds and end of postoperative ileus, as well as no correlation between return of bowel sounds and passage of first flatulence in either the control group or the experimental group using a rocking chair or a non-rocking chair. And these are my references.